The intrinsic foot muscles work in congruence with the bony arch, plantar fascia, spring ligament, and tibialis posterior tendon to maintain the integrity of the medial longitudinal arch. The intrinsic foot muscle on the dorsal aspect of the foot is the extensor digitorum brevis. On the plantar aspect, there are 4 layers of muscles, from superficial to deep, which will not be discussed specifically at this time. These muscles are the flexor digitorum brevis, adductor hallucis, abductor digiti minimi, quadratus plantae, lumbricals, adductor hallucis, flexor hallucis brevis, flexor digiti minimi, and the plantar and dorsal interossi. When the calcaneus is fixed to the ground, the intrinsic foot muscles primarily account for toe movement. Most importantly, however, during weight-bearing activities, the intrinsic foot muscles provide stability to the foot and medial longitudinal arch, and help balance the foot, especially during push-off phase of gait. A low-intensity strengthening exercise for the intrinsic foot muscles are towel scrunches. The patient sits in a chair with the foot flat on a towel. The patient will extend the toes to reach forward and grab the towel, and flex the foot and toes to pull the towel forward. This exercise strengthens the intrinsic foot muscles of the foot by having them concentrically contract to move the towel towards the patient. A low-intensity exercise for the intrinsic foot muscles are marble pickups. The patient sits in a chair with feet on the ground. The patient then uses their toes to grab the marble and place it either in a cup or, in this case, a shoe. This can help with the dexterity of the toes. Towel scrunches with weight are a moderate intensity intrinsic foot exercise. Perform in the same manner as regular towel pulls, but the therapist will place a weight on the towel. This increases the amount of force that the intrinsic foot muscles must produce in order to pull the towel forward. The increase of resistance qualifies this exercise as moderately intense.
Balancing on a foam pad. This is a moderate intensity exercise to strengthen the intrinsic foot muscles. The patient should stand on one leg with the knee slightly flexed, which places more stress on the intrinsic foot muscles. This exercise should be performed with external support to begin and can progress to independent performance. Two-footed anterior-posterior balance board squat. For this exercise, the patient stands on a balance board that moves only in the sagittal plane or anterior and posterior. Our patient is doing the two-footed squat on a wobble board. Ideally, you would want to put them on an anterior-posterior balance board. Here, the patient's feet should be approximately shoulder width apart and the knees should be slightly flexed. The patient should begin with external support and progress to independent performance. Another high-intensity exercise for the intrinsic foot muscles is the single leg 5-point reach. Here, the patient balances in a single leg stance while on a foam surface. The patient will perform a single leg squat and tap an object at 5 designated points that are all in 45 degrees of one another. The dynamic multiplanar exercise stimulates multiple muscle groups and is highly functional.
Some low-intensity exercises that can be utilized early in rehab for active range of motion of the ankle are clockwise and counterclockwise circles and ABCs. The patient sits on a table with ankle hanging off and uses the big toe to draw a circle. They can perform this exercise in a clockwise or counterclockwise motion. Motion of the lower leg should be limited to ensure proper ankle and foot movement. The patient can also draw the ABCs with their big toe. For options, patients can draw both capital and lowercase ABCs.